Hi everyone, welcome to this talk on basics of M-mode imaging. M-mode stands for motion mode, and what it means, you have your 2D image, you drop a cursor line somewhere along that image, and you'd like to know what's happening along that line. So really, on this time depth graph, you have time on your x-axis and depth on the y-axis, and you can tell what exactly is happening with various parts along that line. So you know exactly what the septum is doing, what the mitral valve leaflets are doing across the cardiac cycle, the posterior wall is doing. And then as you see on this image, so this is a very abnormal image, you have a large pericardial effusion here, you have a hugely dilated right ventricle, that's your RV cavity here, and you can see what's happening with that RV wall, for example. So that's a very good way to use the M-mode to check for ventricular wall movements. You can drop that cursor line along the 2D image anywhere where you want to interrogate. So for example, as you see here, they put a cursor line through the aortic valve, and then on the M-mode image, the aortic valve is closed, and then the aortic valve opens, and then again it's closed, and then you have this little box-like shape, so that's the open aortic valve. You can do the same through the mitral valve leaflets, and then you see the anterior mitral valve leaflet motion as well as the posterior mitral valve leaflet motion. So this is really good to interrogate or investigate fine structures. The advantages of M-mode, it is a one-dimensional investigation, so you don't get overwhelmed with all the other information that's available on the screen. And then, as you see in the next slide, this will become as a disadvantage as well at the same time. So this is a time motion graph, and it does provide a superior temporal resolution. The sampling rate of the M-mode imaging is about 1 to 2000 pulses per sec. And if you compare this to the frame rate of a usual 2D image, which is about 30 to 100 per second, you'll see how much extra information you can gain from the M-mode. So with this, you can check for fine movement, fine vibrations of valves and valve leaflets, as well as movement or independent movement of vegetations. If you reduce the sweep speed, you can check for chamber wall movement across respiratory cycle. As I mentioned earlier, for example, this is a good way to check for chamber collapse if you're suspecting cardiac tamponade. The disadvantage is, though, since it's a one-dimensional image and you drop that cursor line, you don't really have spatial information at all. And you drop your cursor line, but then you don't really know what's happening once it's there. The heart could have moved out of that cursor line, so it might not show you the exact alignment that you were trying to do. And also, if for example, that cursor line is not exactly perpendicular to certain structures, then you might do some miscalculations and erroneous measurements of chamber sizes or wall thickness. So you really have to be very careful. And for this reason, M-mode is not recommended anymore for measurements. So M-mode, we don't use it for chamber size assessments and things. However, it is still recommended for those fine structures and valve assessments and free wall assessments as well. Saying all this, quite often the LV, the size and the LV can be quite uniform in its shape, so that a one-dimensional measurement and the calculation of an EF, a T-Colts method, can be reliable enough. Not always, so there is a huge caveat here, so don't use it always, but in some cases, some selected cases, it gives you a reliable enough approximation of LV size and LV function. So these are my resources, and I used some images from these, and the books I would recommend, as always, buy them or read them through your university website. So thank you for listening, and I hope to see you back on one of the further lectures. Thank you. Bye bye.